Hi, everyone. My name is Dr. Beth Brooks, and I'm the clinical advisor here at Vivian Health. And today I'm here to talk about nursing turnover. So each month I put out a video about different issues or challenges that we're having around recruitment and retention and provide some evidence-based recommendations. In the series is called On the Horizon in Healthcare. So today the topic is turnover, and this is one of my soapboxes. And I just want to give you hopefully some really solid information so that you're a good consumer of turnover data, and B, know how to properly calculate the cost of nursing turnover. So it's interesting. And there's a couple of studies that came out a couple of years ago, which I had no idea. The first turnover research was done in 1917. So this is a topic that has been around for many, many years. It is something we have studied from a group level, from an organization level. We've looked at individuals. We've looked at, is it an individual issue that creates turnover? Is it the manager on the unit that creates turnover? Is it something about the organization culture? We've really looked at turnover. I should say, the scientists, the researchers that do this kind of research have looked at turnover from many, many perspectives. And there's a lot we know about turnover, which I think is why one of the things that I get so concerned about when I'm reading literature or reading stories about nursing turnover, 9 times out of 10, they are underestimating the cost of nursing turnover. So that's the focus today. I want to describe for you what's called the nursing turnover cost calculation methodology. It's a mouthful, I realize that, but there is a colleague of mine, nurse expert, who has spent her entire career studying nurse turnover. And I think that her work needs to be central to how we think about nurse turnover. So let me talk a little bit about some of the challenges, right? Turnover, one of the challenges we have is it's not clearly defined by any one organization. We don't have national data about turnover. Sometimes the Hospital Association collects it. Sometimes a Nursing Professional Association collects turnover. Sometimes different consulting firms talk about turnover. So we have all these different organizations supposedly measuring turnover, but what we often don't know is how are they measuring turnover? Because some folks measure turnover and include internal transfers. Sometimes you look at a turnover data and you go, oh, was this voluntary turnover or involuntary turnover? And so there's a tremendous need to be very clear about what calculation you use for turnover, but then also what is included in that calculation. And before I go there, I want to just clarify 2 other pieces. One, there is such a thing as functional turnover. There is turnover that's good. There are instances where there's a need for some turnover to happen in an organization, and that's perfectly fine. Certainly, that's not a strategy you want to have a lot of functional turnover, but some functional turnover is not unusual. Second of all, internal transfers, I would not consider turnover. Some organizations include that in a turnover data and some don't. To me, we need a new metric for internal transfers, because if you are just internally transferring a nurse or a physical therapist to a different department, but they're staying within your organization, I don't view that as turnover. Turnover is when you leave the employment of that organization or that system. That to me would be turnover. So that's just one piece to think about. The other thing to keep in mind is that a retention rate and a turnover rate are 2 different things, right? So, and they're not just the opposite, right? You say, oh, our turnover is 15%, our retention rate's 85%. No, that's not how it works. Turnover is calculated on an annual basis. Retention is calculated from your date of hire. And so being really clear about what your organization is reporting and what your organization is including in turnover data is really important. So here's a couple of interesting pieces of information. Generally speaking, folks will, and you talk to human resources folks, and they'll say, oh, we usually do 0.75 times the salary, anywhere up to 2 times the salary, and say that's the cost of turnover. That's not wrong, good or bad. That's a range. So then again, it becomes challenging to know if your cost of turnover is similar to someone else's, if you're all using a different range as your variable. So I'm going to share with you the nursing turnover cost calculation method, which I hope will help clarify. And by no means is this an easy exercise. It is challenging to spend the time and look at the data and gather the data. But once you have that data, I will share with you a strategy that helps make it a little less onerous to keep on top of what your turnover costs are. But let me just share with you one study that I've not seen repeated. But in 2004, there was a study of a group of academic medical centers, and they found that the cost of turnover was anywhere between 3.4 to 5.8% of the annual operating budget. So let's take a $500 million operating budget. Your turnover costs could be as much as $29 million. That is a huge expense. And no surprise, the largest percentage of those dollars are going towards temporary labor. And generally, it is the most clinical positions that turn over are the most expensive positions, obviously, because those salaries are higher than some of the other staff. So it's just a shocking number when you stand back and go 5.8% of an operating budget is what your turnover costs are. So that's kind of a rule of thumb. Again, the range is 3.4% to 5.8%. So something good to keep in mind. Now, the nursing methodology. Dr. Cheryl Bland Jones started this work way back in the late 80s, 1990. Some of her dissertation work and the first papers that she published were in 2004. The beauty of her methodology is she was very precise in identifying all the pre-hire costs of turnover, identifying all of those, and then all of the post-hire costs of turnover and identifying those. And then she has a spreadsheet, and you could find that data in your organization and do that calculation. No surprise that the largest cost of nursing turnover is post-hire, when you have vacant positions, when you have to reorient someone, when you have to have premium labor filling a vacant position. So the pre-hire costs of turnover are not terribly expensive, but the post-hire costs are. So in her formula, in her calculation, in her research, she recommends you take the nurse's salary, multiply it by 1.3, and that will provide you with the turnover cost for one nurse. Then you would take that cost and multiply that by how many nurses you've had leave your organization. Many years ago, I had a client that I was working with, and they had a $13 million nursing turnover cost problem. Large organization, had many, many hospitals. So it's not for the faint of heart. It can be a big number, which is why it's so important to spend some time both understanding nursing turnover costs, but then trying to determine what are some of the best solutions. So that paper, and again, I will provide you with the resources and the evidence and citations and whatnot, but that research is from 2004 and 2005. To me, those are the gold standard. That's where I go. If someone hasn't used that formula to calculate nursing turnover, I kind of don't really pay that much attention then, because in my mind, this is the most thorough and systematic and well thought out approach to measure nursing turnover. So from this original research, some time went on, and Dr. Jones was asked about, well, what about cost of living? And when the cost of living, the consumer price index. So in 2008, she published another paper and refined her methodology such that you can take that cost of nursing turnover and multiply it by the consumer price index. And again, she very clearly explains that method. And that then will give you an idea of what your nursing turnover is. And so again, once you've done some of that early work to look at those individual costs and you understand it's 1.3, then you just can use that consumer price index variable to bring your turnover data cost up to date. So that's my soapbox. If you're going to calculate nursing turnover, it's 1.3 times the salary times the number of nurses who have left your organization to give you an idea of the costs. A very, very recent paper just came out on burnout. What is burnout cost, and how much turnover is caused by burnout? It's a very new study. I've read through it. There's more work to be done, but essentially the bottom line is the more turnover you have in your nursing staff, the more return on investment you will realize when you implement programs to reduce nursing burnout. So, in other words, the cost of implementing a nursing burnout program to decrease nursing burnout, that cost will be much cheaper, much less than the cost of nursing turnover. So if you ever have those conversations about, well, is it worth it to implement a program about burnout to decrease turnover? The first answer that we've seen, the first preliminary research, is yes, it does. So I'm hopeful today I've given you some very precise resources. Cheryl Jones, 2004, 2005, and 2008. Very explicitly how to measure nursing turnover in a very comprehensive way, how to then be able to update that data based on the consumer price index. And so now you have this method to understand nursing turnover costs. And this would be so wonderful if everyone would use this approach, because then we would know that we're comparing apples to apples, because it can be really challenging. And everyone always wants to know what's your cost of turnover. And it's incredibly difficult to do that right now when we don't have a standard, when a standard definition isn't used, but we do have a standard way of measuring. So I encourage you all to consider using this methodology and this approach to measuring nursing turnover. So thank you for joining me today. I'm going to step off my soapbox, but thank you for joining me. And if you have any questions, you'd like copies of research articles that I've referenced, we're happy to do that. Just reach out to us at hire.vivian.com. And thank you.